We've all heard of a hernia, but how do you know when you have one and how do they even happen? Here to answer those questions today, including treatment options, is Dr. Kyle Seudeal, a general surgeon with Franciscan Health. Thank you so much for joining us.
Thank you for having me.
So first of all, what exactly is a hernia and how do they develop?
So a hernia is the easiest way to describe them. They're essentially holes in the abdominal wall. So sometimes you could be born with these, but most commonly they develop over time. So our abdominal wall can have some areas that are weak at baseline, and then over time those areas can get weaker to the point where a hole forms.
Will you know when you have one?
Not always. If they're very small, you may not have any symptoms related to it, and it may be picked up if you were getting a CAT scan for something completely unrelated or an ultrasound, something along those lines.
What are the most common symptoms, and are there symptoms more prone to be felt by men?
So the most common symptoms that people experience are pain, or they notice a bulge in the abdominal wall. So when it comes to the pain, a lot of times what people will report is the pain will tend to increase with activities. So if they're doing some heavy lifting, or let's say they're out on their feet all day or so forth, they'll notice some more discomfort. With regards to the bulge, they'll also notice, well, hey, as the day progresses, that area seems to get bigger over time. And then once they're back home, they're resting, relaxing, that bulge starts to go down and sometimes goes away. And then the next day, this kind of cycle repeats.
Yeah. So what are the treatment options?
So unfortunately, when it comes to hernias, that hole that's formed, it's never going to go away on its own. So surgery is really the only cure, so to speak. Now, when you're talking about surgery, we have different techniques that we employ to fix these. So there's the traditional open approach, which is essentially wherever the hernia is, we make an incision over that, and we fix the hernia kind of from the outside in. Okay. The more recently, though, we've adopted a lot more minimally invasive techniques. So either laparoscopic or, my preference, robotic. And essentially what that is, you make a few small cuts, maybe about 1/2 centimeter to 1 centimeter. You go in on the inside and you fix the hole from the inside.
What's recovery like?
So most of these surgeries are same-day operations. So folks come in, they get the operation. As long as they're doing well, they get to go home. Sometimes for larger hernias or patients who have more complex medical problems, they may need to spend the night in the hospital, but usually they're home the next day.
All right, well, we've got much more on this. You can join us for our extended conversation on WTHR.com/realmenweargowns. Dr. Kyle Seudeal, thank you so much for joining us.
Thank you. It was a pleasure to be here.
All right, so we continue now with our extended conversation. Are there risk factors that men need to be aware of? In other words, something that we do that could make us more prone to a hernia, or is it non-discriminating?
So in general, because these develop at areas where the abdominal wall is weak, anything that increases pressure inside the belly essentially can cause the hernia to form. So things like being overweight, conditions such as urinary retention where you're having to strain, my patients with chronic constipation who also have to strain, those kinds of things can cause the hernias to form.
Are there complications or risk factors for ignoring it or not getting it treated?
So the hernias, if they're small and they're not causing any symptoms, a lot of doctors will recommend, hey, we can just keep an eye on it, which I think is appropriate. But things that can develop over time, if it's not addressed surgically, the hernia can get larger. Folks can start to have more pain related to the hernia. And then in the most severe case, the most worrisome case is if that hole gets big enough, sometimes you could have part of the bowel protrude through the hole and get stuck and get trapped. When that happens, then sometimes it could lead to a life-threatening situation that requires emergency surgery.
Are there any preventative measures men can take to reduce their risk of developing a hernia?
Yeah. So much like a lot of other medical, comorbidities, diet and exercise is really the key. Eating healthy, getting good exercise, drinking plenty of water, eating a good amount of fiber to reduce the risk for constipation, that sort of thing. Those are all things that men can do. Now, I will say, some folks, they can do all the right things and they can still develop a hernia. It's just the nature of the beast sometimes.
How often should we be getting checked for hernias? Should we be getting checked for hernias, especially if we're one of those people with higher risk factors?
Sure. So at least once a year during your annual physical examination with your primary care doctor, that should be appropriate. If you start to develop symptoms, you feel like you may have a hernia, then by all means get a hold of your doctor sooner to get it evaluated.
All right, doctor, thank you so much for being here and helping us out.
Yeah, thank you for having me.
All right, we'll see you
Appreciate
next
it.
time.